So one of the conditions that I commonly see is conditions involving the front of the foot, which we call the forefoot, under the base of the second toe, where the ligaments become worn out, stretch, and ultimately tear, causing the toe to drift over or form what we call a hammer toe, which is a bending of the toe or a small deformity of the toe. So hammer toe conditions, along with these injuries to the ligaments, are very common. The injury to the ligament specifically is called a plantar plate tear. The plantar plate are ligaments that go from the base of the second toe onto the bottom surface of this long bone, which is a metatarsal bone. This comprises the ball of the foot. Patients who have this condition will usually have some sort of feeling of fullness or feeling like they're walking on a lump or some sort of a small bump under the foot. They'll even sometimes take off their socks to check their shoes, obviously to find that really nothing is there. The condition is really inside the foot. The condition occurs because of maybe chronic use or even an injury. We treat the condition both with surgery and with non-surgical treatments. Non-surgical treatments would involve some sort of taping or padding, putting a splint on the toe, possibly even orthotics to support the arch, better shoes, and maybe even physical therapy. Once those conditions are tried, which we always try those first, we sometimes get to the point where we need to progress the treatment a little bit if it's not satisfactory doing the non-surgical treatments. At that point, we offer the patient surgery, and if they do decide to go forward with the surgery, we proceed with fixing the ligaments, repairing the ligaments, which we do using basically an incision on the top of the foot, which means we're opening up a small part of the skin over the joint and using special instrumentation to both find the ligaments, put stitches through the ligaments, and then connect the ligaments into the bottom surface of this toe bone. Once the ligaments are repaired, the patients usually have to stay off the foot for a while until it heals, and then gradually we return them to their normal activities. The surgery tends to be very effective. Most patients do very well and are very happy once they had it done. These conditions do become chronic, and if untreated, they can lead to complete dislocation of the joint where the toe is literally sitting on top of the metatarsal. Obviously, in a condition like this, very, very painful to walk on, and although patients do endure the pain and walk on it, they're suffering, and I would say suffering needlessly. I would much rather have the condition where we're just fixing the ligaments rather than having to fix the dislocation of the toe, although that can be done too. So if you would like to find out about this condition further, if you feel like you may have a condition similar to this, please give us a call at the number below.